Okay, guys, we're going to go over what functional medicine is today and how it differs from conventional medicine. So, functional medicine is also known as the medicine of why. Why is a certain thing happening to you? It's not so much what is happening to you, more as why it's happening to you, and what is the root cause of why that's happening. And so, up in this tree, for example, you see that there's, this says gastroenterology. I know this is very small. Gastroenterology, endocrinology, cardiology, pulmonology, urology, hepatology, immunology, and neurology. I even had to look close at this thing. So, sorry that the graphic's small, but the bottom line is there's these entities out there. You have cardiologists, or you have urologists, or you have endocrinologists or gastroenterologists, right? And they do their own thing of diagnosing. So they may, gastroenterologists, they may, do a scope, an upper endoscopy or a colonoscopy, whereas an endocrinologist may use an ultrasound or lab work or thyroidectomy scans to diagnose you, or a cardiologist may do a cardiac cath or a stress test or an EKG or an echocardiogram or something like that, right? They're going to find out what is wrong with you. And that process is called diagnosis. And I think that's where conventional medicine does a really, really good job. They can kind of figure out where you fit in what little box, and then conventional medicine has its way of treating those things, right? Whereas in functional medicine, it's about treating the root cause, right? So instead of addressing what you have, although that's important to know what you have, a diagnosis is important. To figure out why you have it, I think it's probably a more important thing, because in general, in conventional medicine, I know this is a really cliche thing to say, but we treat symptoms, let's say you come in, you're complaining of anxiety, we give you an anxiolytic, if you're complaining of pain, we block the pain with an opiate or with an NSAID, like ibuprofen or something like that. If you have allergies, we block histamine, right? If you have skin problems, we give you a steroid. If you have an autoimmune condition, we block the immune system from working, right? So that's how conventional medicine kind of goes about these things. It doesn't necessarily go to the next level or next levels of why you actually have that process. So this is actually one of my favorite slides. I took this from one of my mentors, Dr. Kalish, and basically this is what people come in for. They come in for weight gain, they come in for autoimmune conditions, they come in for pain, they come in for fatigue, whatever the complaint is. But that's actually what's happening is there's a breakdown of, and this is a simplistic model, but it's a breakdown of some body system. Okay, there's something that's breaking down in your body for you to have those symptoms or that phenotypic or what we see as a disease process. And so something has to be broken down here, but that doesn't necessarily mean that if we can figure out that it's, let's say your GI tract or your liver or your hormone system, that's the problem, that's the underlying root cause. Now we're just again a next level of diagnosis. Then we got to figure out, well, how do they break down, right? Well, they break down because what, again, my mentor, Dr. Kalish, calls the 4 horsemen, or it's excessive inflammation, catabolic physiology, which basically means excessive cortisol from stress, insulin resistance, which is where your body can't handle blood sugar, very well, or excessive and oxidative stress. And we're going to talk about all these in great detail in the future. But in the end, even if we can, figure out that your CRP is through the roof, and that your cortisol is through the roof, and your A1C is 8%, and your, antioxidant levels are low, and your oxidative stress levels are high, that doesn't necessarily still answer the fundamental question of why you are ill. And that goes to the next list, and this is the underlying causes, and this is where functional medicine doctors should be the most comfortable, and this is where they want to be. Doesn't mean we don't care about this, doesn't mean we don't care about this or this, but we want to know why. And this is not an exhaustive list by all means, but it can be related to any kind of stressors. It could be dietary stressors, it could be infections causing a stressor, it could be emotional, spiritual, traumatic stressors, it could be toxins, it could be related to poor sleep, it could be related to your lack of exercise or over-exercise. So in the end of the day, this is where we want to focus, because if we can figure this stuff out, then all this other downstream stuff will sort itself out, and we won't have to keep you on a medication that blocks the pain or puts you to sleep or boosts you up with energy, because we're going to treat the underlying cause, and these other systems are going to start to work, and then you won't have these symptoms anymore. And that is the difference between functional medicine and conventional medicine.